What is treatment heterogeneity? Well, let me explain that by using Alcott's 2011 article. Say that you are being told on your energy bill that you are doing much better than the neighbors. So your electricity consumption was way lower than that of your neighbors, and actually also lower than that of the most efficient neighbors. So you're doing great and you get lots of smileys. How would that affect your energy consumption? Anyone's guess, but it can either be that you ignore this message, that you already know that you're doing very well, or it could be that you now think, well, maybe I'm overdoing it a little. I can leave the lights on a little longer than I used to. Alternatively, it may also be that you're told that you're doing much worse than the neighbors. So your electricity consumption last month was like double that of your neighbors, and your efficiency standing is not so good, and you get one tiny smiley. It's still saying good, but obviously you're below average. In that case, the message is pretty clear, right? That this suggests that you can easily save on your electricity bill because comparable households consume much less. So maybe this gives you an incentive to actually look into this and to indeed try to lower your electricity consumption. This is an example for which it holds that the effect of the treatment may depend on a pre-treatment characteristic of households, in this case their electricity use before the treatment started. And this is new because so far we did not look into this variation in the treatment effect among groups, because in Econometrics 1 we implicitly assumed that the average treatment effect gives you a good idea of what happens when you administer a treatment. And here are the different research designs that we discussed in Econometrics 1, remember, each with their own estimation equation, but in all of these cases alpha 1 gives you the average treatment effect, and supposedly this gives you a good idea of what a treatment does to a population. Now, as in Alcott's paper, it may well be that this assumption does not fly, that people respond very differently to a treatment. And so alpha 1, we may want to split it out between groups. So that gets us to the definition of treatment heterogeneity, the degree to which subjects respond differently to a treatment. Let's have a closer look then again at that example, Alcott's 2011 randomized controlled trials. And for now, let's assume that we only have one observation. So our estimation equation is exceedingly straightforward. We just ran this randomized controlled trial. We only have one observation, for example, a couple of months after the start of the treatment. And then we're going to estimate alpha 1. Now say that you would do that with the data of Alcott, then you are not going to find much. So you find a small effect, and it may also be statistically insignificant. So based on Econometrics 1, you would conclude this treatment doesn't do much. But then if you look closer, then you find that, well, the treatment effect really depends on pre-treatment use. So no effect between control and treatment for households with a low usage, and a clear drop in electricity consumption for households with a high usage before the treatment. In that case, pre-treatment usage is a moderator, as shown here in the causal diagram. It's in between the treatment and the outcome, and it affects the strength of this relationship. Obviously, this is something that we want to explore and that we want to test for, right? Because this is very relevant for policy because it changes our conclusion. If we look at the average treatment effect, then we may conclude that not much is going on, but it seems that we could draw a more nuanced conclusion that it makes sense to target this treatment on households with a high usage. And next is, how are we going to go about exploring this heterogeneity in the treatment effect?